Warrior. My sister Warrior. So we are live now. How you doing?
Hello.
This is me, and this is my sister Warrior. Y'all heard me talk about her quite a bit. And she said she would come over, and as we're getting ready to launch Secure My Medical Records online and all the different things, she's nervous, talking about, this is my first time. I ain't never did nothing on Facebook. What we gonna talk about? What we gonna talk about? And I said, you know what? I'm just gonna push start because I can't give you what we gonna talk about.
Okay.
And so I just looked at her and said, listen, we're going to talk about what you brought into my space. Mm-hmm. Remember, you told me when we were first going through, you said, Deron, we are the what?
Reality.
Tell me, why did you say we're the reality?
So I think because you had some preconceived notions, you had some areas where you felt like, I really need this help, but I'm afraid what people will think. Mm-hmm. I'm afraid that if I talk about CBD, I'm a pastor. What is my
terpene?
Terpene. What is the flock gonna say about me talking about terpene? And so you were nervous, you were scared, and so I had to tell you, Deron, you're living it. You're not telling them something is happening to other people.
Right.
You need this. You need this terpene. This is saving your life. I saw from where you came. I saw what it has done for you and how it's helped you.
And when you say you say from where I came, so that anybody watching knows, what does that mean?
So when you were in the hospital, you were going through severe pain before the hospital stay, during the hospital, the headaches, you were suffering. And then they were prescribing oxycodone, OxyContin to help you, but that was making you feel not yourself. You couldn't tolerate it well. And it wasn't until you started this terpene oil that you were able to not even ask for a prescription. You remember calling me saying, can I get a refill on this? Can you ask the doctors to give me a refill? I'm almost out of pain medicine. But you were able to transition.
I sure did.
From Percocet, because of these headaches and stuff, completely off. And we haven't had a Percocet prescription or OxyContin prescription in 2 years.
Wow. Since
you started this terpene oil.
I forgot about that, baby. And what you're saying is, and this is why you helped me remember, that I would have pain, and by the end of the day, I was crawling up the stairs on my hands and knees.
Right.
And I didn't know what was going on. And the reason I said my warrior sister is because you had to go into the doctor. So when we're talking about Secure My Medical Records, every time I went in, they would go through this whole list of asking me, what was I taking?
So just for the medical portal portion of it, because I'm in nursing, and right now my job is to get patients to come in and see the physicians and get worked up for a transplant. Mm-hmm. But the bulk of our job is to get patients' medical records. I have probably 4 staff members that they spend all day calling patients, asking patients, well, where did you have this test? And call this doctor to get this test. And we can't actually bring the patient to be seen at my clinic until we have all of their medical records. So this could be months. Wow. And then the poor patients, they will call and the doctor says, oh yeah, we'll send them. A week goes by, 2 weeks go by. They call us, do you have the records? No, we don't. And then we have to start the process all over again.
Let me ask you, does that mean that the patient doesn't get seen?
No, the patient can't get seen until we get the records.
Wow. And so you say you have people that's all they do is try to help people get their records.
Yes, because that's the only way we can bring patients in is if we have their past medical history.
Right.
So we spend days and hours just trying to get people to get their medical records. And then the patients are frustrated because they'll call and the doctor's office will say, I'll send your records. And then when they call us back to schedule the appointment, we say we don't have the records. So then it's Groundhog Day. You have to start all over again. And sometimes this could take a couple months before we can even bring the patient in for evaluation.
You remember that time I went to the doctor and she began to talk to me and I said, do you understand? Mm-hmm. I looked at her. I'm struggling.
Right.
And she began to talk to me and she was looking at the computer, and I said, do you understand that I'm so-and-so?
Right. She was looking at the wrong record.
She was looking at the wrong record.
Right.
And if I didn't have the wherewithal to say, do you understand whatever you're saying? We just saw each other.
Right.
Couple of weeks ago.
Right.
But she was on this pace. And I finally, and I said, and then she stopped, pulled up and said, oh, I'm sorry, blah, blah, blah. And she did what she had to do. But had I not said anything,
right,
she would have put me on something else.
And so for the medical portal portion of it, if patients have the ability to have their medical records, when they see a physician, that physician upload those medical records, that's right there in their hand. And they can come to us, and there's no delay. They could call and make an appointment, and we're measured by how fast we can get patients in to see us.
Really?
Yeah. So if a patient calls...
When you say we're measured, what do you mean?
So my job is to take the data. How long does it take from referral to appointment?
Right.
So if someone calls in June and I can't get them into November, they're looking and say, why is it taking 5 months to get a patient? And what my answer is, because we couldn't get their medical records.
Wow.
So that's why I have staff constantly calling to stay on these patients, because we're measured by how fast we're getting patients seen. I
want y'all to know I'm hearing all this for the first time. Right. And this is why I'm really happy and just elated, because that delay, somebody can lose their life.
Absolutely.
That delay, somebody could lose their life. That delay, somebody could not be able to get it right. Before I go any further, I'm so happy to be able to say, if you want to be a part of the test of SMMR, secure my medical records, send your information to soldiers-outreach.com, soldiers-outreach.com. And you send your information, because they've given me the opportunity to be able to send it out now, and you get to try it for free. It's a test. And you get it for 30 days. And if you want to keep it, you can, but there's no obligation. It's going to disappear off your computer anyway if you don't want it.
Right.
But they'll get to see it, play with it, do what they got to do. And listen, and it's not just playing. You'll upload some of your records. You'll upload these different things so you can understand that, Sharriff, I don't know when they changed it. But at some point in the medical field, they made all records go digital. Do you remember when that happened?
Right, so all records are digital. It probably happened a couple years ago with a couple of different new servers that they have. But for the most part, yes, the records are digital.
Right, and so now, with the Secure My Medical Records, all they got to do is give you the email. And then we're going to help them upload.
Right.
If for people who have a problem, we will have it at the church. We will have it at certain locations, and you'll come through and we'll help you upload.
I mean, just imagine the pressure that, because I do it for you, imagine the pressure that it takes off of a patient.
Tell me, when you say I do it for you, what do you do?
So I help you navigate the healthcare system, because it's daunting.
Okay.
And so when your physicians say, hey, what was your last blood test? I'm able to pull it up, and we'll be able to pull it up on my medical records and have it on your phone. If you can't remember, or if the doctor hasn't done it, it's right there. And one thing I wanted to tell you was, a lot of times patients, when they go into the physician's office, we talked about this, they don't have their records. And so the physicians aren't able to really give them a true diagnosis at the time that they're there, or actual plan, because they have to say, well, thank you for coming, but we have to wait until we get your records to make a decision about what to do, because I don't know if you've had this test, this biopsy, this x-ray. If you have it right there in your hand, it doesn't delay your care, and it doesn't delay what the doctor needs to do to get you to the next step with your health care. And so some people are going to need help. Seniors are going to need help uploading their records. And just patients, family members, everybody.
People who's got Parkinson, people who have motor skills. For me, I'm asking people, print it out for me.
And people like me that are just lazy and would rather pay somebody to do it.
Right.
And not have to worry about doing it myself, because I don't have time. My plate is full.
Right.
But I have a service that you're providing that I can just, hey, this is my information, upload it,
Right.
because I have a busy life. I don't have time to do it.
Right. And so I want you all to know, I'm over here. You can't see my eyes because I'm over here tearing up because she's reminding me just how difficult this thing is. And if I didn't have you, I wouldn't be here. I'm so glad you sent me the letter when we were going through.
Right.
And you said, hey, I need you in my life.
Right.
It was a red envelope.
Mm-hmm.
And I collapsed on that sidewalk and said, wow, should I call you or should I not call you? I had missed your 40th birthday party. Like, you just showed me a picture when you was pregnant with Bryce. And listen, this woman was pregnant with, that's all I'm going to say. Which means I never saw her while she was pregnant with Bryce.
Right.
I'm just understanding that today.
Right.
And so, God
gave us the time back, though, Deron.
Yeah, he did.
He restored it. And he restored it better than it was before, because I don't want to get into it, but he restored it, and he restored the relationship, and the bond was never broken. I told you years ago, the longest bond that's shared between two people are siblings. And so I told you that years ago. Our bond is going to be the longest bond that we have. We're going to outlive our parents. It's the longest bond, and God restored that. And now, I was the little sister. He was like my dad, but now I think the roles have reversed a little bit.
Yes,
Thank
you're
God.
here telling me what to do.
Finally.
I just say, tell me what to do.
Right.
Just tell me what to do.
Right, finally.
And I'm so happy, and I thank God for the people
Right.
at Dr. Henry Lamont, who is one of the ones that literally, if you send me your information, you're going to get his private email address, because I need to get feedback.
Right.
And so I need your help to be able to continue this movement, because it's the forefront and people are going to know, like I did a broadcast yesterday, Sharriff, to say, I was just concerned. And then God said, no, people are going to remember this, Deron.
Right.
And when you go through this, you want to know, why am I here? So when I'm asking you, y'all have heard me talk about, Sharriff, had I allowed that foolishness to stay between us,
Right.
I'm dead.
Right. And me too. Me too. But I think what I want to say is, the last thing I'll say, I've been in the medical field and nursing field for 15 years, the medical field for over 25 years. You know that.
Right.
And the crux of everything that we do is surrounded by medical records. That's the crux of the medical field. And so if patients have the ability to own their medical records and have their medical records available to physicians, and for mommy, I'll have mommy and daddy's medical records. So if daddy has a problem, I go to the hospital, it's on the phone. His med list is on the phone. His previous x-rays are on the phone, and I can just give the doctor the link. They can pull it up. It's going to preserve and it's going to save lives. And so, talking to you about that, medical records is the crust of healthcare. And this portal is going to give us the ability to own and take back the control that we've kind of lost with the big systems.
Yeah. So I thank you. Hey, y'all, this is the first time we've ever even done anything.
I did good.
You did very good. She act like she was nervous, like she ain't, what we gonna talk about? I don't know.
Right.
I'm so nervous. What we gonna talk about? So just wait a minute, tell me one more time. I said, listen, I am pushing play or whatever that button is, and we're going for it. Hey, you all, I got more announcements to make, but you get this for 30 days free, and the reason you get to do it. And listen, so that you understand, nobody understands. It ain't going to cost no more than $10 a month.
Right, and I waste that a day on coffee.
Listen, this is a patient's portal.
Right.
It ain't going to cost you and your family. It's got the dentist. It's got the pulmonology. You're going to see me. I'm literally getting ready to do a demonstration. I just got to get it all set up. And I can show the app to everybody.
Right.
And I'll just say this. If you got distance in your relationship, and you and your sister, your brother, your mother, your father, y'all going through dumb stuff, you don't know that this day will come. For somebody, a crisis is on its way. Everybody has a crisis in their life. And if you hold on to your unforgiveness, you hold on to wherever you are and don't reconcile and just say, hey, I need this. I had no idea when I humbled myself that I would be diagnosed with brain cancer.
Right.
I had no idea. But I'm so glad that I did it. So my prayer for you, with the new ministry of health, where God is truth, that you accept that truth and ask yourself, what am I mad about? What am I going through? Right. And we did. We picked up like we never left off. And I helped you, and now you're helping me. I thank you all. Know this, I'm no longer ashamed of my tears. Remember, you and Ma got on me. I was sitting right here, and you and Ma called. I said, I'm sorry for crying, and y'all said, cut that out.
I'm so sick of you apologizing for being upset. It's okay. You don't have to protect us anymore. That's what we're here for. You know, and I can tell you, being in the medical field, I thought I knew it all until I had to step back and help him. And then I realized the challenges that patients have, you know, and so I have always been an advocate in my heart, but to actually I have to fight. I mean, I've had to fight to get things done for patients, and that's why this portal will take some of that away, because it'll be available.
Yeah. So, hey, y'all, I thank you for listening. I thank you for praying. I thank you all for helping.
And this is going to benefit you.
And it'll benefit. That's it. If you want information, send it to this. And when I just realized next time I do this, I got to send out Dr. Henry's information as well. His contact information. So I'm going to come back, guys, and do that. Just know this is organic.
Right.
And like he told me yesterday, he said, Deron, Rome wasn't built
in a day.
So I felt bad, like, you don't even have that. Just go to soldiers-outreach.com. We'll send you the information. You'll get his information, and you'll be able to talk and do what you got to do. Okay. Love you all.
Do we say cut?
Huh?
Do we say cut?
Yeah, say cut if you want to say cut. You stimple. Hold on, don't say nothing stupid, because I got to stop each one.